Hi, my name is Tiffany Evans, and I will be doing my presentation on having a son with diabetes. 1216, 1216, 1216. This number will stay in my head for the rest of my life. Today I'm going to tell you about type 1 diabetes, also known as juvenile diabetes, how we found out my son was diabetic, and how he is progressing. Type 1 diabetes is different than type 2. Type 1 is when your body doesn't produce enough insulin or doesn't produce insulin at all. A lot of people think diabetes is when you can't have sugar, but diabetes is more of like being on a low carb diet. You count your carb intake. Type 1 diabetes is found in children as early as birth. I have read stories and diabetes is being misdiagnosed as the cold or a flu. I tell people all the time, if you see your child is drinking and urinating more, please have your child checked for diabetes. Now that you know what diabetes is, I'm going to tell my son's story. It was December 2006, and it started with a phone call from his daycare on a Thursday, saying that he didn't want to eat and she didn't think he was feeling well. So I went pick him up and brought him to the doctor, and she told me it was a cold. Over the weekend, he was just drinking and wetting diapers. So I called the doctor, and she said he was getting dehydrated from the medicine and to stop it. Well, that Monday, my husband called me telling me he was throwing up and wouldn't stop. So we brought him to urgent care. As my husband and I waited in the room with our son, hoping for answers, the doctor came in and told us he didn't know what was going on. It wasn't until the nurse came in and said to check his blood sugar, and it read off the meter. And that's where 1216 comes in. For those who don't know much about diabetes, well, 1216 is extremely high. As a doctor once told me when he found out what my son's blood sugar was, how the hell was he walking and talking? Adults can't function over 500. We knew then that my son needed to get to a hospital and quick. We were rushed to Children's Hospital in New Orleans where we stayed for a week. In that week, we had to learn how to give insulin shots, count carbs, check his blood sugar, and tell what was normal and what was not. A few months after my son was diagnosed, he had a seizure in my arms due to a low blood sugar. At the age of 3, when most parents are teaching ABCs and 1, 2, 3s, we were teaching him how to check his blood sugar to prepare him for school. Now that you know his story, here's where we are today. My son is now 11 years old, and every day is different. He now knows how to check his own blood sugar, give himself insulin, and count his own carbs. We have tried different insulin methods like the insulin pump, and the pen, which he uses now. Currently, my son takes Humalog, a short-acting insulin, every time he eats, so about 6 shots a day. He has to have 3 meals a day and have a snack in between his meals to keep his levels balanced. He also takes Lantus, a long-acting insulin, every night. He checks his blood sugar 6 or more times a day, and I still get up in the middle of the night and check his blood sugar. My son is on a 1 to 15, so that means for every 15 carbs, he takes a unit of insulin. Looking at my son, we will never know that he has diabetes. He plays football and baseball, which he is really good at. His speech is delayed due to the diabetes. We have to get his eyes and teeth checked annually. He does wear glasses, and his manual is poor in his teeth. He does have extra time on his test because low and high blood sugars can mess with his concentration. The school system, in my opinion, is not accommodating my child's needs, and with the lack of knowledge of school officials. He is currently going through a hoarding stage where he steals and hides food. 2 years ago on my birthday, my son was at my friend's house, and she called me. My son was lying on her bathroom floor, throwing up, and he was very weak. He was admitted to the hospital and put in ICU. Because his blood sugar was high due to him stealing food. We have spoken to his doctor about counseling, and there aren't any children medical counselors in my hometown. He was referred to Tulane, but there is a 4 to 6 month wait. There aren't any support groups in the area, but this summer he will be going to juvenile diabetes camp in North Louisiana. Every year around his birthday or when he hits a growth spurt, we have to change his dosage. He does have friends with diabetes, one who's a little girl who he has been going to school with since he was 3 years old, and their stories are similar. She runs on the low side and he runs on the high side as far as levels go. We go to the doctor every 3 months, and they check his A1C, which is his overall blood level. He is currently at a 10 and should be at a 7. My son's levels aren't where they should be right now, but we have come a long way since he was diagnosed with a blood sugar of 1216 at 2 years old. On average, my son's blood sugar runs around 200, and they should be for his age, between 80 and 150. Well, this is what diabetes is, how my son was diagnosed, and how he is progressing. I hope one day that there is a cure for diabetes, but until then, I hope my son Kivon's story helps spread awareness for type 1 diabetes.